Well, good afternoon and welcome everyone to today's webinar. We're going to hold on just a minute or two and let folks finish getting connected, and we'll get started here about 2 minutes after the hour. So thank you again, and we'll be getting started here in about a minute or so. Again, welcome everyone to today's webinar. We're going to get started here in about another 45 seconds or so. We're just giving folks some time to finish getting logged in. Good afternoon, and thank you all for logging into today's webinar. We're going to get started here in about another 30 seconds or so. We're just giving folks time to finish getting logged in. Okay, well, let's go ahead and get started, and we want to welcome you all this afternoon to today's webinar, Cyclospora, Part 2, a regulatory approach. We are very excited to have you joining us today, and for those of you that were unable to participate in Part 1, it is recorded and available. If for some reason you can't find that link, just email us at asto@asto.org, and we'll get you a copy of the earlier presentation. That presentation focused on the epidemiology and laboratory methods related to Cyclospora. Today we're going to focus more on the regulatory approach to Cyclospora. So let me begin by welcoming our panel from FDA. We're very excited to have all of them participating. Among our participants today, we have Crystal McKenna, who joined FDA in 1989 as a science policy analyst in this office of the Center Director. After a series of details, she took the position of the Office of Compliance, where she has worked in various capacities since 1992. In 2003, she took a 4-month leave of absence to teach HACCP in Ecuador as a Fulbright Fellow. She has a PhD in food science and human nutrition from the University of Florida. She started her college career as a botany plant pathology major and spent many happy hours at the agricultural research stations. So she feels like she has come home to working in produce safety. Our second speaker is Maria Knirk, who has been with FDA since 2016. Starting in the Office of Executive Programs, she's worked in Citizens Office of Compliance, Division of Enforcement for almost 2 years. She is the Deputy Director of the Division of Enforcement, where she focuses on developing the produce team, outbreak compliance and enforcement activities, and various other special initiatives. Maria went to law school at Michigan State University College of Law and is admitted to the New York Bar and has a master's degree in business. In addition, I believe Maria has a distinction of having worked in at least 3 departments of agriculture at the state level. Our third speaker is Joanne Gibbons, who I know you all know well. Joanne serves as the Director of the Office of Human and Animal Food Operations West within the Office of Regulatory Affairs of the Food and Drug Administration. In this leadership position, Ms. Gibbons oversees the Human and Animal Food Program Work Plan, accomplishments, implementation strategies for the Food Safety Modernization Act, and program alignment advancement. She also collaborates with the Center of Food Safety and Applied Nutrition and the Center of Veterinary Medicine, ORA components, and external stakeholders. Prior to serving in this position, Ms. Gibbons served as the Acting Regional Director of the Central Region for several years, Deputy Regional Director in the Central Region, and District Director in the Detroit District. Joanne is a graduate of Berkeley College in Little Falls, New Jersey, and also majored in biology at Keene University in Union, New Jersey. She has received numerous awards and is a member of numerous professional associations. Well, we're going to go ahead and begin the presentation. I'm going to turn it over to Crystal.
Hey, thank you so much. I hope that all of you out there were able to join the May 15th webinar with Dr. Straley, Almeria, and Dr. Silva. They really did the heavy lifting when it comes to the biology of Cyclospora cayetanensis. If you couldn't join, I hope you can watch the recording of the webinar, which you can find on the AFDO professional page, which was mentioned earlier. So first you're going to hear from me, Crystal McKenna, and it was also announced that you're going to hear from Joanne Givens and Maria Knirk. I'm a compliance officer, so I'm only going to touch on some of the technical aspects of our regulatory approach. Maria and Joanne are going to talk about some of the aspects of who is involved in the investigations and how we can work more closely with our state partners. So this first slide that you're looking at, and let me just remind you that of something that Dr. Straley pointed out. Cyclospora is a parasite, and it's a human parasite, so the only known reservoir of Cyclospora cayetanensis is the human gut. And also something that Dr. Straley mentioned is there is such a thing as a Cyclospora season. And if you look at this slide, what you see is the Cyclospora season from 2018. Now, I could have picked the data from 2019, but there's so much, this slide illustrates so many concepts that I picked this 2018 epidemiology. So as I mentioned, you see that this season goes from May to August, and then along the y-axis you see the number of illnesses. And you will also notice that it calls this cases of domestically acquired cyclosporiasis. So the way CDC makes that distinction is if a person says that they were in a foreign country where cyclosporiasis is endemic during the incubation period, then they are not going to appear on this epi curve. So you'll see the vast majority, these are color-coded, which I like, tells part of the story. The gray bars represent illnesses for which we don't know what the vehicle is. Now, again, Dr. Straley pointed out that currently there is no validated method for subtyping and linking outbreak individuals to a particular outbreak. We do that with Salmonella and E. coli 015787 and Listeria, but we can't do that with Cyclospora. It's a parasite. You can't grow it in the lab. So these methods are being worked on by CDC, but also FDA. And hopefully we'll have something in the future. But so you see that the vast majority of these, about 2/3 of these illnesses from 2018 there was no vehicle that could be identified. We had a little bit better luck with the outbreak associated with the blue bars. This was parsed out, and maybe some of you were involved with this. This was parsed out by state public health departments and individuals and CDC the people remembered what they ate, and it turns out that this was linked to a consumption of vegetable trays that were purchased at a convenience store chain. These are stores that were associated with service stations, gas stations, and so people could pull in and get their gas, and they would pick up a vegetable tray, getting something healthy, and maybe they let it sit in the car. Why that would be significant is that Cyclospora is not immediately infective. It requires a period of time outside the host, somewhere between 1 and 2 weeks, to become infective. The Cyclospora is shed from humans as oocysts, and until they sporulate, they're not infective. So what FDA did with this outbreak is we tried to do a trace back of the components. The veggie trays were composed of celery, carrots, cauliflower, and broccoli. And so we tried to trace back each of those components to see if there was any convergence for a particular farm or distributor, whatever. We were not able to find a particular farm or distributor. And when we collected samples of the vegetable trays, each of the components, we were not able to identify Cyclospora. So I think that's kind of typical about what happens in outbreaks. With the yellow ones, which I saved for last, we had a little bit better luck. This was an outbreak associated with consumption of salads from a fast food chain. And you can see that there are just a few illnesses in May and June, like one or two each day. And then towards the end of June, it starts to spike, more illnesses. And then after the end of June, the numbers start to decline really rapidly. So FDA again tries to trace back where the salad came from, and when you look on this timeline, you see that there's a blue arrow right around the 13th of July. That's the date when the fast food chain quit selling salad at their fast food restaurants. So a few days later, on the 19th, FDA collected a sample of unopened lettuce mix from a distributor, and it was headed to that particular fast food chain. When we analyzed it, we were able to find Cyclospora cayetanensis in that salad mix. Now, note that even though we found it, this is kind of unusual, because usually if we find pathogens associated with an outbreak in a particular outbreak commodity, that outbreak is still ongoing. But if you look, on that particular day that we collected it, there was only one illness. And so that outbreak was basically almost over by the time we picked up that salad mix. Then we traced back each of the components of the salad mix to see if, let's see, I think I'll go to my next slide. Next slide. Yeah, so what was our investigation into that salad mix? We traced back each of the components, and we could not find a single farm or supplier that could explain the outbreak. What we did find was that there were 4 harvest crews from one contract harvester that could explain the illnesses. So then the next thing we did was decide to investigate those 4 harvest crews. So how do you do that? Next slide. Okay, thanks. So we were very fortunate to be able to get the cooperation of a single grower. Now, the grower was not associated with the outbreak, but that grower cooperated with us and allowed 4 harvest crews to harvest the romaine that was on that field. And we took 4 samples. Now, a sample for FDA could be somewhere between 15 and 20 subs for Cyclospora. And of those 4 samples that we took that corresponded to one of each of those harvest crews, 2 out of those 4 yielded Cyclospora cayetanensis. So then we said, well, we need to find out, is it in the field or is it, associated with the harvesters? And so we collected 2 large 15 to 20 samples of romaine, and each of those were negative for Cyclospora cayetanensis. Next slide. So the next thing that we care about, and let me just say that this is typical of what we would do, and we would go and try and investigate what the cause of the contamination was. But then our next concern is there a product on the market that could be affected? And because the salads were discontinued on July 13th and there was no additional response that was necessary from the fast food company or its supplier. And it's really typical for us to see voluntary compliance. The farm that was associated with the findings voluntarily destroyed all the harvested and unharvested product. And this is, again, typical. Next slide. So what are the potential sources of contamination? If you think about the biology and if you think about the reservoir, which is the human gut, you have to start thinking about portable toilets. There are a lot of reasons why portable toilets are a pretty good potential source of contamination. One of them is that the methods of cleaning sanitizers are ineffective against Cyclospora. They work against Salmonella. We would never discourage people to not use sanitizers on portable toilets, but they're ineffective against Cyclospora. Another one is that, as I mentioned, Cyclospora has an obligate period of time after it's shed by the host where it needs to mature and sporulate, and the portable toilet could be a place where that could happen. So we did not find the smoking gun in the case of the romaine. We don't know how the contamination occurred. We can't even say, even though we found it in product that was harvested, we can't say that it was the harvest crew that contaminated it. I think we need additional evidence to nail that down. Next slide. So what are the potential routes of contamination? One could be agricultural water. Depending on how you look at it, agricultural water could be either a source or a route or both of contamination. Obviously, there's worker hands, but again, I mentioned Cyclospora has to sporulate. We don't expect to see transmission from person to person the way we would with Salmonella. Worker clothing, boots, smocks, gloves, harvest tools, these are all potential routes of contamination. Next slide. So what is FDA doing about Cyclospora? One of our very best tools, since we don't have genetic subtyping, is sampling. And we started in the middle of July of 2018 to do a big sampling assignment for herbs, cilantro, basil, and parsley. And it's not just domestic, it's also import. So as of May 26, 2020, there are 708 samples that have been analyzed for Cyclospora. More than half of them are, I think it's like more, yeah, it's right, well, more than half of them are domestic samples, and 4 out of the 409, that's a little bit less than 1 in 100, yielded Cyclospora cayetanensis, 1 from Oregon, 1 from California, and 2 from Hawaii. For the foreign firms, we had 13 out of 299 samples of imported herbs, 5 from Colombia, 1 from Costa Rica, 1 from Ecuador, and 6 from Mexico. I can't say that it's statistical that Colombia and Mexico are more highly represented, because we took more samples from Mexico and Colombia than we did from some of those other countries, partly because Mexico and Colombia supply us a lot of cilantro and basil, respectively. So future sampling will be future sampling that we might be doing on for Cyclospora will be decided based on outbreaks and in response to findings, but also FDA, the Center for Food Safety and Applied Nutrition, has a Cyclospora task force, and one of the things that they do is make recommendations. We also may take recommendations from a meeting that we have biannually. We started last year and we invited industry and academia, CDC, and we possibly in our next one will be including state participants, but the next meeting is under consideration because of COVID-19. But that group could also make some recommendations as to what samples FDA might be taking. Okay, next slide. So what tools does FDA have available to us to respond to Cyclospora cayetanensis findings? So it says domestically grown produce, but this same thing is true also for imported produce. Produce is adulterated within the meaning of 402A4 if it contains Cyclospora cayetanensis. It is, the only source of it is human feces, so a finding of cyclospora in food is evidence of direct or indirect contamination with food, and thus it's filth, but it's also injurious. Next slide. So just like we would any other adulterated food, our goal is to remove adulterated product from the market. And this happened really on a voluntary basis in each of the cases. And then prevent introduction of adulterated product onto the market. And that also happened on a voluntary basis for samples that corresponded to domestic produce. Then the next thing that we want to do is to prevent future adulteration. And this is probably our biggest challenge, doing a root cause investigation and looking into the corrective action. In the next slide, we're talking about the tools that we have for removing product from the market. We will always correspond with the state that associated with the finding, and voluntary recalls, again, are our biggest tool, and then we also have press. Now, I didn't list mandatory recalls because FDA doesn't have that authority for farms. Next slide. So preventing adulterated product from getting onto the market. As appropriate and based on findings, we will work with the state that corresponds to the sample and the farm to effect voluntary hold. State embargoes could be useful if voluntary action is not forthcoming. We do have tools, an administrative detention order that we could use. That's generally followed up with a seizure, and I will note that seizures always require documentation of interstate commerce. Next slide. So preventing future contamination and root cause investigation. When FDA and we will be discussing with our state counterparts the most appropriate way to cooperate on an investigation. And we will evaluate the relevant evidence and investigate potential sources, the ones that I mentioned before, water and portable toilets, so forth, and begin the investigation where the evidence leads. So in the case, for example, of the lettuce outbreak, the mixed lettuce, the salad mix, we didn't look at a specific farm. We looked at the harvest crew because that's where the evidence led. And so we will continue to follow the evidence as it develops. Next slide. So I just want to point out that a lot of the produce safety rule covers a lot of those preventive measures that control cyclospora. Policies and practices, training records are required by the produce safety rule. Workers are required not just to wash their hands, but to be trained to wash their hands and to have hygienic practices and to maintain their tools such that they are not a source of contamination. So a lot of this is in the produce safety rule. Next slide. There is a requirement in the produce safety rule that requires farms to exclude persons from work that if their work could result in the contamination of covered produce. I think it's a little bit tricky to know whether someone's sick or not. There's no, in the United States, we're not allowed to force workers to take tests. But cyclosporiasis is an applicable condition. So if it's known that a worker has cyclosporiasis, they should be excluded from work based on the produce safety rule. Next slide. So to prevent future contamination, investigating the source of the water. So FDA agricultural water includes water that comes into contact directly or indirectly with produce, like irrigation water and water for pesticides and crop protection sprays, water used in harvesting and post-harvest washes. Post-harvest washing can amplify the problem by distributing the spores from contaminated produce onto previously uncontaminated produce. Agricultural water by itself is a potential source of Cyclospora cayetanensis. There's some evidence that it could be in some of the irrigation water in the United States. We are aware of instances where sewage has accidentally spilled into irrigation canals. FDA doesn't have jurisdiction over the irrigation canals, but we do have jurisdiction over water that comes into contact with produce. And next slide. So on the 15th, you heard from this gentleman on the left, Dr. Alex Silva, and one of his coworkers, Helen Murphy. They are the ones that developed the method for finding Cyclospora, the one that we're using now, 19B. It has been so helpful for us. For years, we didn't have any samples that yielded Cyclospora. Now, I don't have an updated list of the states that we are working with, but I know California, Minnesota, and North Carolina have been trained on this method, and I believe there are a couple of other states. So we're happy to have you guys join us on Cyclospora findings. So we are now able to test for Cyclospora in water. I think Maria is going to be talking about that a little bit later. Because the concentration is so low, the sample has to be concentrated, and before we can find Cyclospora. What about soil? Well, at this point in time, we won't be testing soil because we don't have a method. So next slide. So at the end of an inspection, an investigation, I should say, if there are any violations, they'll be noted on a 4056 and discussed. And again, we're going to be looking for voluntary correction. We think it's faster and better. And we care about just getting that adulterated product off the market and hold potentially adulterated product and eliminate, if we can, have them eliminate the sources and routes of contamination. That would be the corrective action that we would want to see before they went back into production. Next slide. Again, I just want to emphasize that our compliance strategy is more about voluntary than it is about taking big actions. We've had regulatory meetings, and those can be followed up by reinspection. Next slide. So midway through 2018, FDA began testing for Cyclospora in herbs, and it only took a few weeks before we found the first positive in domestic product, which led to additional investigations. As we move forward and the states bring more staff on board to inspect on farms for the produce safety rules, and as the state RRTs investigate outbreaks and FDA sampling continues, there are a lot of entities who are going to be involved in a possible Cyclospora cayetanensis investigation. I'm going to turn my time over to Maria Knirk. She's going to look at a more detailed application of who and what will happen this year for investigations related to Cyclospora cayetanensis. Thank you for your attention.
All right. Thanks, Crystal. So as Crystal mentioned, my name is Maria Knirk, and what I'm planning on discussing today is, for many folks on the line, I hope a review of a discussion that Crystal and I had last year, although we weren't fortunate enough to have AFDO host us. So what I'm going to be doing is going over a more detailed kind of process-driven style for the investigation, since Crystal went over the big picture of our investigative objectives related to our the science that we're looking at and some of the challenges to investigating Cyclospora. So the first part that I want to make sure that you remember is that this was initially based on a process to following up on the herb sampling assignment, and it was built off of how we respond to other, pathogen positive findings in manufactured food, but then We had essentially some new kids on the block with bringing in new partners in produce safety, as well as new folks in FDA for responding to that. And so we had to start to look at a way to blend based on where the collection occurred during the herb sampling assignment, and then framing out the different stages and steps to the investigation. And so this is also going to be similar, as we've started to receive more questions, to what we would look for a state-initiated sampling. And I've made a few tweaks in this chart, as you'll see in the next slide in a moment, to where we would look to basically partner with our, whether it's a state doing the sampling or whether it's FDA doing the sampling, but to basically partner with our state, with our food safety partner to ensure that there's good communication and follow-up. So this portion is broken down into 3 different phases, and each phase has a couple of different tasks or objectives. And what I've tried to do in here is, you'll see throughout it that I have a who, and then I have a few more notes. So what I want to do is give folks a reminder about the regulatory tools, as Crystal had suggested, but then another piece that I'd like to make sure that we're reinforcing, and then Joanne is also going to reinforce, is our communication with state partners, because that component is paramount to our efforts. So the first phase, as you can see, is that pre-farm investigation and looking back to the herb sampling assignment. That was based on sampling at warehouses and distributors, not at the farm level. And so what would happen is it would start as a pre-farm investigation based on where the sample was collected. So our first, sample 1, that first sample would come in and it would be a positive Cyclospora cayetanensis collected by someone at the HAF division, a compliance officer, or a CSO, pardon me. And the first part of that is, after we get the information from the lab, is we want to notify our food safety partner. And this is what I've tweaked. At first, it was notify our state counterpart. But in this case, it works both ways, that if the state is doing some of that investigation, we'd look to make that connection very quickly. And the next part would be in task A. So we want to get in contact with our partner and then get to the sampling location and reach out and find out where the origin of the produce is. Of course, we would start this a little bit differently if the sampling had been started at the state level, but that's not something right now that FDA is starting at from a surveillance perspective. So as a reminder, who would be involved in the notifying our state food safety partner, our food safety partner, and then who would be engaged in some of those follow-up conversations? This is going to be initially led by our HAF division, whether it's a compliance branch, the investigation branch, that'll involve our recall coordinators, if there's going to be a recall. And then, of course, we'd want our state liaisons to be aware, and the emergency response coordinator. What we have in here is that we're going to have a state contact. This sounds like a big list, but these groups work together already. And so it's just a matter of making sure we have enough of the same people together. So whether it's our state contact, depending on if it's initiated by kind of the manufactured folks, or if it's the state PSN, kind of the state-funded version of implementing the produce safety rule. We'd also want our CIFSAN Office of Compliance involved. So that's Crystal and myself and our team. And then our ORA PSN needs to be aware, because if we are headed back to the farm level, we're going to involve our ORA PSN. And of course, CORE, because of what Crystal talked about with our struggles related to identifying clusters and traceback when it comes to outbreaks, we want to notify CORE signals. Okay, so it's a little bit bigger party, but in task B, we're going to start to tighten things up. The next part is discussing a recall with that warehouse or the distributor. Same with the farms. In this case, to remind you, Crystal kind of talked about our adulteration charge in here. It's a 402A4 adulteration, and we do consider this to be a class 2 hazard, not a class 1. What that means is that we don't have mandatory recalls for either the warehouse or the distributor, and FDA does not have that authority at the farm level. So we're talking about typically voluntary action, because that's quicker and more protective of public health. The scope of what we'd look at is a discussion of what product is represented by that sample. So is it a production date, a harvesting date? Is it specific that we can get to a harvesting crew or a harvesting individual depending on how that information is tracked. The next thing that we'll look for in terms of those tasks that we're trying to isolate and complete, and again, this frequently happens when this already happens with our folks who've been involved with this, would be looking at a trace back and a trace forward to provide that information to core signals. And so who's involved in here? This is going to be our state, this is going to be our HAF division, core signals is going to be involved. And so it would just depend whether it's a state sample. The state would likely start to lead that if it's a HAF division, including our partners. So if the warehouse or distributor initiates a voluntary recall, we're going to slide them right over to work with the recall coordinators using Chapter 7 of the RPM. That's, a wonderful outcome. It's what we'd like to see. It's a struggle because sometimes the age of the product doesn't really lend itself to quickly executing a recall, and traceability can be a challenge. If we don't have a voluntary recall, what we do is we'd like to have a conversation with our state about what tools may be available. We could also pursue strictly public notification of the positive, as well as disclosure of the sample source as a safety alert to make consumers aware of that information. So in that case, what we'd be looking at is our HAF division, our state partners, CISCION OC, our Office of Compliance, we will work on that, and then our communication teams. So third task and last component in here in that pre-farm investigation, that is evaluating, understanding and evaluating the handling practices that occur. So in here, as I'm sure everyone kind of quickly jumped to, the standard that we're looking for as a comparison, generally speaking, of course there are size-based exemptions and others, is going to be comparing it to either the preventive controls or the produce safety rule. So that's what we're really going to do to evaluate it. Of course, we're also going to use some of the very specific areas because of the knowledge that we have on Cyclospora cayetanensis. And so we would really look to explore some of the, how might there become a hygiene problem when we're talking about a fecal oral contaminant. And so we'll get more specific in looking at some of those areas, just as Crystal outlined. The idea of what we're trying to achieve here is to determine if the contamination could have or likely happened at the sampling location, because remember, we're at a warehouse or a distributor right now, or at a previous handler. That really helps us to identify where the bulk of our investigation should occur. So again, this is something that we would look to our HAF division or our state partner leading, and then we would have some pretty constant connection with our other state partners, whether it's the state PSN, the ORA PSN, and then our CISCION Office of Compliance to work on making sure that we're all connected. So then our outcomes in here is what's next in that box. If we find the likely route of contamination, then we would try to do sampling and confirm. Again, sampling does not prove if we have a negative, but it can confirm that we have one location, and it's a helpful context to keep in mind. We would, of course, document the deficiency, try and do a trace forward, identify if there's other product that warrants recall or voluntary action on, and then we would work with the firm. Right now, we're still at the warehouse or the distributor to ensure that they are voluntarily implementing mitigation and corrective action plans. And so we would have our state, the HAF division, and then our center consults involved in making sure that we evaluate that corrective action plan. Now, as is the case often, if the likely source or route of contamination is not identified, we're going to go back one step further. So we're going to use that traceback that we obtained in task 1 and 2, A and B, pardon, and then we are going to get back to a farm or another distributor. So if we go to another distributor, we will, engage in the evaluation of the handling practices. We'll look at traceability and understand that. If we get to a farm, then what we'll do is we'll move to phase 2. So next slide is phase 2. All right. So this is our on-farm investigation portion of this, and this is where we really have a bunch of new groups to coordinate with. So as a reminder, this is when we've got that trace back to a positive sample or to a farm identified through outbreak traceback. It's going to be a very similar investigative process. The folks at the party here are going to be our ORA PSN. Based on how staffing is or where some of the staff are already at, this could also involve our HAF division and hopefully our state partners, so that state PSN primarily, but it could involve some of our other traditional manufactured food partners. And once we get to the on-farm investigation, we're looking at Part 112 and 402 of the FD&C Act. So we're looking at conditions and handling practices, and we're looking at the produce safety rule. The first task here is to notify the farm, determine if they're still operational, and whether they're subject to the produce safety rule. We'll want to help them understand what the information is related to the sample finding and request documents related to that original kind of sample one that initiated this investigation. We would also want to determine what sample one represented. So as we talked about before, whether that had already been commingled, whether it could be traced to a specific harvesting team or a harvesting individual, whether it can get us to a specific field or area of a field. This is the type of thing that we want to understand is, what does it represent? So the folks that are going to be involved in this, sometimes this could happen through a phone call. So we might have our HAF division on there. We would certainly have our ORA PSN or our state partners, and then we would continue to involve core signals. The second task in here, task B, is going to be our follow-up sampling, where we anticipate that we're going to do more product sampling. And new from last year, so this is one of our changes, we can add in ultrafiltration water sampling. So I'll talk a little bit more about that, but essentially we've been able to get it's an ultrafiltration, so it's a high volume water sample method, multi-lab validated to several of our ORA laboratories. And so our PSN investigators, the ORA PSN, can go out and perform this high volume sampling and send that filter rather than what we've done in the past, which is send about 25 liters of water through the mail or lugging it into a laboratory. Now we can actually run 25 to 100 liters of water if we're doing the sampling through this ultrafiltration process and simply send a filter. And then once it gets to the ORA lab, they run a backflush and can perform the analysis for Cyclospora cayetanensis. And as part of this, our ORA PSN would work to determine which laboratory the samples would go to. So obviously in here, I would need to add our ORA ORS would also be involved in the analytical process. So that's kind of a twofold component here is we want additional sampling of the product as well as to consider whether water sampling is merited. If there are no positive sample results from that, we share that information with the farm and with our partner, and then we continue on to task C, so our next one. If we have positive samples, then what we'd be doing is looking for a voluntary recall and a hold discussion with the firm, because now essentially we've found 2 contamination events and we need to follow up on that one. So we have the original sample 1 that got us back to the farm, and then we would have another one. So we would be looking at partnering with our state. The ORA PSN would be involved, our Office of Compliance, the Division of Produce Safety, ORA, ORS would be involved in talking about the method and sharing the outcomes, and then our HAF division is going to be involved as well. The next thing that happens, again, this is if we have some of that, the second round of product sampling is positive, is that we're going to expand our sampling to similarly situated commodities. So that's a third round, and that's where if we found it in cilantro, we might expand to basil or to parsley. So again, this is going to be a similar cast of characters, and we would anticipate that our ORA PSN is involved in that. Our state partner, the Division of Produce Safety, might provide recommendations on what that similarly situated commodity is based on what the farm is growing. And then there may be a few other folks involved in that, but that's our primary cast of characters. if we have positive water samples, we are going to want and need help to work with the farm to immediately address and implement controls to address water. We need to determine whether we're going to request or work with the state to implement action related to produce on the market and produce shortly to be marketed, and ensure that we have appropriate voluntary action by the farm. So we would have CFSAN Office of Compliance would be involved in this. Division of Produce Safety, our state partners, and the ORA PSN would be deeply involved, as well as our division partners. So this is going to be a lot of phone calls and a lot of understanding what that water impacts throughout the farm. The third task in this one is that observational investigation. And this is really going to be happening at the same time as the second one, but we tried to outline them as two different types of investigation. So the observational investigation is where we're going to understand the handling practices. We're going to understand health and hygiene. We're going to take a hard look at toilet facilities and hand washing facilities and handling practices and looking for potential sources and routes of contamination. So this is where we'll have a lot of connection with the ORA PSN and our state PSN. And then we'll have connection back to the Division of Produce Safety at CFSAN, as well as our Office of Compliance. And so we'll be working very closely to understand what that whole process is from the beginning to end, to try and identify potential areas that are lending themselves to contamination. If we identify no significant issues, then we wouldn't take additional action except as warranted by the sampling. What we would also look for is if we do identify significant or potential routes of contamination, we are going to document those routes of contamination and work with the farm, our state partners and the farm, to develop a mitigation strategy and look for voluntary action for corrective actions, and potentially to evaluate produce that's currently on the market. So we're looking for, and I can't express this enough, voluntary corrective action. Our state tools on this one, we have, we might work with our state on what tools are available. FDA may look at a public notification. We also have, as Crystal talked about, administrative detention orders, but they would need to be closely followed with a seizure. And so our who in here is going to be the Office of Compliance, our Produce Safety Network, whether it's ORA or the state, likely in connection, and then the Division of Produce Safety. So this is one of those situations if we do identify significant likely routes of contamination. So third slide, or I guess next slide, third phase. Thank you. So the third one is recognizing that investigations have to come around to the end. And so kind of we have these two outcomes. We would always favor our first one in identifying likely sources and routes and helping ensure that we're getting corrective action so we can assess the adequacy of those corrective actions and do reinspection, get out and perform additional sampling, and continue to work with, in this case, either the farm or the distribution or warehouse or other handler that may have created the contamination event. So that'll be our state partners working with the Office of Compliance. We would also be working with our Produce Safety Network, the HAF division, I should add here. But this is just going to be part of the process where we remain well connected to evaluate what those conditions are, and we may consult some of our experts throughout the center that are specific to cyclospora contamination. A reminder here, kind of our tools. We have accelerated follow-up inspection. We have advisory actions, injunctions, which are a much longer term leverage. And then we have our potential state tools. If in the unfortunate circumstances that we don't come out of this investigation with a likely source and route identified, then we would ultimately close the investigation and continue the investigation elsewhere, or look to implement additional screening or consider additional follow-up to maintain our surveillance of some of these areas. We have gone back to certain locations a couple of times to do investigations, but one of these things is that we really want to continue to maintain vigilance for consumer safety. So I believe in our next slide, I'm going to hand this over to Joanne Givens, and she is going to talk about something near and dear to our hearts, which is our coordination with state partners. Joanne?
Thank you, Marie, and good afternoon, everyone. I'm Joanne Givens. As was introduced, I'm the Program Director for the Human and Animal Food Program West. And I just wanted to share with you when we're engaged in some of the activities for which Marie and Crystal described, communication, of course, is key. And that means probably routinely on a daily basis, talking to one another as we try to get to the bottom of the follow-up. And so certainly traceability is always a factor. And to the extent we recognize that many of us collect samples, FDA, our state partners collect samples, it's kind of hard to determine which ones are going to end up being positive for Cyclospora. But nonetheless, it's important to try to document as to the greatest extent possible to where the sample was collected, and certainly if it's imported, where perhaps it came from. And the reason for that is, as you well know, is once it's determined to be a positive sample, the product moves very quickly, and oftentimes there are short shelf lives associated with these products. And trying to move to as quickly as possible to make sure that the product doesn't remain in commerce not one day longer after we learn that it is positive, it behooves all of us to have that information. So trace back documentation to the extent possible during sample collection. And then as we all know that once we determine that the product is positive, and that package comes to FDA for review from we will send it to our Office of Regulatory Science in ORA, as well as to our CIFSAN scientists for analytical review to ensure that all of the methodology is complete and that we can move forward. This is a solid sample results, and the analytical findings are solid as well. And again, as Maria mentioned, there are a lot of folks that join the party in terms of our state partners, our produce safety network folks, and oftentimes our divisions. And we are looking to determine what best course of action is necessary. And then we realize that communication is two-way. States want to know they're involved, if they collected a sample, what became of that sample, and vice versa. If the state became aware of it, or if FDA became aware, let's engage one another. So the communication is certainly two-way. And certainly we don't want to create black holes. So nothing could be more frustrating than to become aware of a positive sample results and not know what became of what was the outcome. But oftentimes when we find ourselves in a positive sample situation, our compliance branches are going to be the ones who get the ball rolling. All of our recall coordinators are within our compliance branch, and they report to our compliance branch directors. And as I mentioned, we'll engage our Office of Regulatory Science as well as our CIFSAN laboratory for those analytical package reviews. And also, we need to make sure that the packages are solid, because it's going to be necessary for us to support any particular compliance action. Next slide, please. So we thought it was important to show our map of where we have our 12 human and animal food program divisions. I just want to note that the West program includes our produce safety network, and in fact, they report to the Division of Domestic Human and Animal Food Program Operations. Just for the sake of our imported products and commodities, we will have to include our Office of Enforcement and Import Operations, and specifically our Division of Import Operations, to work with them to try to do the trace back and make sure that we can nail down the entries for which that product came into the country, the farmer supplier. We need to make sure that we have all of that information. And that, again, going back to the point of collection, recognizing that we won't always know when we're going to have a positive sample, but to the extent we can document that information during collection, it really saves us time when we are trying to do our trace backs and trying to reach out to the responsible entity for which we're going to ask the question of what are their intentions with regard to this, the positive sample results. And again, we want to communicate all of our findings to the appropriate offices. And oftentimes, if it's an FDA collected sample, making sure if it's domestic, we certainly will be engaging our states. And if it's something that the states have done, collected, we certainly, whether it's domestic or foreign, FDA needs to know about that so we can start that recall process if, in fact, we are able to achieve that through the voluntary nature of our firm and farms. So next slide, please. This is kind of breaking down the specific contacts in each of our half divisions. There are 6 divisions in the East and 6 divisions in the West. And this chart here just gives you points of contact from our program division directors, from our state liaisons, our emergency response coordinators, our directors of investigations branch, our directors of compliance branch, and then the last column shows our recall coordinator. They are there to work with you all in any situation that may involve a recall, certainly to ensure that that process is working, to make contact with that particular recalling firm or farm or entity. Just that, again, they are a resource. So we think this is an important slide for you all to know who are your points of contact in the respective divisions. The next slide, please. That's just reflecting the West, for which I am responsible for. And again, these are our points of contact in all of our 6 West divisions. Let's go to the next slide. So we just wanted to bring this discussion home to a more recent situation we found ourselves in. We had a successful, I believe Krista mentioned the states that are now doing this analytical work. And in the case of a most recent example, we had the state of Minnesota collect samples under the FERN sampling program. They collected, imported, I believe, basil, and it tested positive for cyclospora. They immediately contacted our Minneapolis district office, our Half West 1 division, and our compliance branch there began the process of sharing the analytical package to our Office of Regulatory Science as well as CISAN. Those packages were deemed to be solid, but then we needed to go back and try to determine from a traceback standpoint where did the product originate from, specifically the farm, whether the importer did any manipulation or did any repacking of the product, just trying to understand what was going on from the time in which it came into our country. And so that's why it's really important, to the extent that we can collect that information upon sample collection, that it doesn't, we don't lose any time in terms of trying to go back and conduct these trace backs. But nonetheless, we were able to work through that. But what does that help us to do? It helps us to, first of all, to start to work with our Division of Import Operations and determine, whether we can change the screening criteria of this particular entry, looking at whether or not we can do 100% screening. So all products coming from that particular farm, once we have identified them, can go on to 100% screening. In the case of the most recent samples that we had of imported basil, we were able finally to make all of the identification for the trace back. We reached out to the importer, made that call and made them aware of the positive test results, and they voluntarily recalled the product. So that's just one piece of it. Certainly on the import side, we still want to make sure that there is not a problem with products continuing to come into the country, but we also want to deal with the product at hand for which we are aware of. In addition, we wanted to look to see whether or not we can add it to Import Alert 9935. And again, because we needed to determine where exactly did the problem occur. Was there any manipulation of the product once it was imported into the country? Where exactly is the product? So again, a lot of follow-up, a lot of details, part of the investigation. And again, we can determine based on our additional screening, whether it's 100% screening, whether we want to collect additional samples. So again, that is just something that's part of the process. And as the time is going on, again, we're trying to get this product off the market to ensure that we have we're preventing it from reaching any other consumers once we have identified the product and the lot. And oftentimes that we realize a lot of these are commingled, and that's sometimes also challenging for us. But at the long and short of it is that communication is key. We don't want to be made aware of a positive sample, and then our state partners are not aware of what action was taken with FDA. So we continue to provide that feedback loop of communicating with them and let them know where things stand. There was a voluntary recall that came out of this. We also conducted a foreign supplier verification inspection at the place in which the product was distributed from, and there was a voluntary recall. So I think that, again, we have many things that we can address in follow-up to a positive test result. It oftentimes takes many, many resources, but what's key is including and communicating with all those principals that need to be made aware and making sure we close that loop so that there is no black hole in terms of folks not understanding and what was done with regard to that particular positive sample. So we really do have a great story in that regard. But again, what I would like to stress is the collection of identifying information upon collection, because again, we don't know, we don't want to delay and have product on the market any longer, knowing that it is positive for a cyclospora or any other adulterant. So with that, I'm going to turn it back over to Marie, who's going to walk us through the 2020 activities. Thank you.
Thanks, Joanne. All right, so Crystal talked a little bit, actually quite a bit, and Joanne, about the various tools that we have. And so what we wanted to do is actually provide you with more of a list of what all FDA has planned for 2020. So I'm just going to go through this, and as I talked about earlier, we've got some new stuff, we've got some existing surveillance, and then we've got some targeted pieces. So the first big piece that I'm pretty thrilled to know that we have rolling is the ultrafiltration water analysis that the ORA labs are now in a position to perform. We followed this throughout the process and the method development, and we're pleased to know that if we do engage in some for-cause investigations, we can now run those ultrafiltration water samples, or rather, at least the filter, can be sent to some of the ORA laboratories to perform that analysis. And so we really think that this new method and means of environmental sampling is going to provide us with some robust information. We have 2 import alerts that are of high importance to us when it comes to Cyclospora cayetanensis. The first one is Import Alert 2423. This is an import alert that's been in place for just over 5 years. It is related to, it's a seasonal import alert, so it's the only one of its kind. And so it kicks in every, basically a month before the annual, what we think of as Cyclospora season. Many people think of that as outdoor picnic season, but Crystal and Joanne and I look at this as Cyclospora season. And so this is a seasonal import alert that requires a green listing approval, so prior approval, for either firms or farms in the state of Puebla, Mexico, to import or offer products for import to the United States. So we've been working through listings on this green list and evaluating petitions for listing, and are pleased to have several on the list, but we continue our efforts there. The other import alert that we have that really relates back to Cyclospora is 9935, which is our other findings. And so this is different because it's a red list structure. And so once we have information to suggest where the contamination may be occurring at import, we would typically use that information and put the firm on 9935, which is a 402A4. So it's in sanitary conditions based import alert. And so then that particular product would not be permitted entry to the United States if it's linked with either that packing house or a particular farm. So those are our 2 big import alerts. As you know, just what Joanne talked about and Crystal talked about, we look to have voluntary recalls in place when we have either trace back during an outbreak, or we have positive product identified through our analytical methods. Two big things that we have from core in here is, as is normal, our outbreak signals team is working with CDC to ensure that we're monitoring and looking for clusters of domestically acquired Cyclospora cayetanensis, and we would have a response team ready to flip that to response and coordinate the traceback and the multitude of clusters that we've seen in the past. Another piece in the background that's working is what we have as an import bulletin. Our import bulletins focus on targeted screening and sampling, and that would be a slightly different cadre than another import bulletin in place. And so that's where we look to perhaps firms that are not on an import alert, or firms that are still a part of previous investigations. So there's an import bulletin that's looking for that. And then if we jump down to the status, there's another import bulletin with alternate criteria from other countries where we have seen Cyclospora positive samples in the past. So increasing where we have prior knowledge and history of seeing Cyclospora contamination. Crystal really talked about the herb sampling assignment. That is coming to its last couple hundred samples, and so we anticipate that will wrap up eventually. It's been an incredible information tool for us and has helped us inform on the import bulletins and some of our other surveillance work. And now, from what Joanne talked about, we've got our coordination with the states and on any either domestic or import signals that we have. So we're looking forward to coordinating with our states, and then also coordinating compliance actions where we have findings either from FDA or from our states that link back to import, and trying to ensure that we engage in a open and robust investigation of those sampling findings. And so we are encouraged by the findings and the inquiries from the states that are interested in engaging in surveillance sampling for Cyclospora. And we're going to continue to maintain that open dialogue and try and chase down our investigations, which from Joanne's summary, you can tell can lead in a number of different directions. So there's a lot of coordination to happen as a part of those investigations. If there's anything else, I know I'm finished kind of going over our 2020 activities, but I want to give Joanne and Crystal an opportunity as we pass it back to Steve and Amy, and I think it's Brenda, to handle any questions.
Hi, Marie Joanne. I'll just mention that what we probably failed to mention is some of that, these imported sample findings can also lead to us targeting a foreign inspection to see what is really going on the ground wherever the sample may have originated from. So I don't want to lose sight of the fact that these are things that we do in response to things here, a domestic side. But if we have grave concerns and want to really get an understanding of what is going on a particular farm, we can always target that for a foreign inspection. So just wanted to share that with the audience as well. That's the only thing I wanted to add. Thanks so much.
Great point, Joanne.
All right, thank you, everyone. Remember, if you would like to ask a question, if you will type that in the question box. And we are going to go ahead and start with some of the questions that have come in. So the first question I have is, are there any developments of a test for Cyclospora? And I will let you three decide who wants to answer that one.
So this is Maria, and what we talked about is the ability, and Crystal mentioned this, is that we have now the ability to do water filtration for looking for Cyclospora cayetanensis contamination. And Crystal mentioned that we do not have a method for soil, but I'm not sure if the question gets to if there are human tests and what those are, because I can, not necessarily happily, but I can very clearly let you know that I outside my lane to answer anything related to the human testing capacities.
Yeah, so this is Crystal. That's Yeah, I would just like to add that if people are interested in discussions about methodology, I would just have them review what Alex's presentation from the 15th, because that's what he talked about is methodology. And there is a method, a panel that is used by the public health department, but for clinical samples that, but I can't speak to that. That's out of my lane.
Okay, thank you very much. And we have another question. Are the foreign suppliers from countries like Mexico or Colombia, are they usually agreeable to a voluntary recall of the produce products?
Yes. Generally they are. A lot of times the recall will be done by the domestic importer. But yes.
Okay.
Well, Maria's pointing out to me in an IM that there was one firm that had some significant reservations, but that was a firm that was identified through traceback and EPI, and we took several samples of their product, and none of those samples yielded cyclospora. I mean, I will say that just because a sample doesn't yield cyclospora doesn't mean that a firm's product is not contaminated. So, because like a lot of other pathogens, cyclospora is it sporadically contaminates food. But yeah, for the most part, yes, we do get cooperation. If we have samples that yield cyclospora, we don't have a problem getting cooperation.
Okay, thank you. Again, if you have a question, please feel free to add that into the question box. I have another question for you. When additional information being collected with samples, such as the harvest company or the crews that are harvesting the product when sampling is done on the farm?
Are you asking the question, is that information being collected or should it be collected? I'm not sure I understand the question.
The question is additional information being collected?
Yes, we would prefer that information be collected. But again, we recognize Crystal shares the stats with you, which I think she said 1 in every 25 on the imported side and 1 in every 100 samples. And we realize that that's a lift. But again, from a public health perspective, when we find ourselves in dealing with a violative sample every day that it's delayed, and these are some metrics that we are thinking about collecting, from the time in which we find that there's a problem, how long did it take for us to get the product off the market? And again, that's a critical public health goal of ours, to try to lessen that time to the greatest extent as possible. So from that standpoint, on the domestic side, we do collect that information because, again, we don't know at what point in time. We don't have to collect the actual documents that show the interstate commerce or show how it was transported, but to identify who those individuals or the harvesters or the distributor or who they are is going to be critical, and it will be a time saving when we have a situation that's violative.
Okay. Do we have anyone else who would like to ask a question? Please put it in the question box. With no additional questions, I would like to thank you all very much for being our presenters today. This was a very interesting topic, and I know that we gleaned a lot of information from it. And I'd also like to thank everyone who took the time to be on the call today. We appreciate you. We hope you have a great weekend. Thank you.
Thank you so much.
Thank you.